for doing it and doing it so well over the past 10 years. Most institutions come into being because there's a crying need in society to do something and to serve, and we will see that happening time and time again, that these institutions leave a lasting legacy behind. When we started Apollo Hospitals, when Chairman came back from really a very good and a strong practice in the US to come and serve his nation, because there was a need in society. When Apollo was started as a hospital enterprise, there was a need in society for that level and that quality of healthcare. When the pharmacy started, when digital started, when the clinic started, everything started because there was a need in that area. And this is a very specialized baby, maybe because it's only 10 years old, the way it is now, but that's because there is a huge need in society. And you heard from both Harshad, from Sunita, from Vishal when he spoke, that we really have to do this. And we'll do it because there is a responsibility from our side to do what we have to do, consistently with the highest level of quality, the way Madhu said, zero harm, to just focus on outcomes, because I think that is the numbers which we're all looking at, that the outcomes have to be phenomenal. We have to make that difference. It is not just providing interventions for the patient, but to just be a holistic provider for them. And to me, that is what is going to make a huge difference. So this is a promise in the 10th year that we will leave no stone unturned to see that the patients and their families have the whole Apollo ecosystem behind them, taking care of them. You have a display of everything which we offer from just this division. But imagine that this has the whole Apollo ecosystem behind it, and then we have a healthcare blanket, we have a healthcare sheet taking care of you, and that is the promise today. Again, we stand by our quality standards. We stand by the fact that we must make that promise. We want that seal of quality for everything which we do. So we will see that if JCI will give us either a stamp or the standards or the NABH kind of accreditation, and we've got a fantastic CEO in place, and I'm sure that he and his team will find ways to get that stamp of quality so that care is consistent across every ecosystem. I'm glad that we started in Chennai, but we're in 13 cities. But if we can really impact that 1 million lives and make it 10 million lives soon using technology, we would feel like it is just a beginning of a job well done. I think that should be our next goal. And having said that, there's a huge space, a crying need in geriatric care, the way Sunita said, in mental health, because people really need that love, that touch, which our hospital system not necessarily needs to intervene. So we will look at different ways of doing that. We will look at, again, the happy stuff, the baby care, when moms need us in that space. Aftercare, when people go home from the hospitals, and sometimes long-term care, cancer, nephrology, so on and so forth, does not need you to be in the hospital for the everyday care. And maybe you just need a doctor visiting you or a nurse visiting you every day to go back and tell your children. So we'll use technology, we will do that, we will do the visits. And I think we will just make high-end healthcare at your doorstep, in your homes, to see that you feel safe, you feel secure, and well looked after. So that is the 10th year promise, and I'm sure the team will deliver on it. Thank you.
One of the important divisions of healthcare, home healthcare, is a decade of service. But it takes me back almost 50 years ago, when I came back from US. I was really saddened that there was absolutely nothing available, and we were truly a third world healthcare service. So, being a doctor, when you see patients who could have been helped if their facilities were there, and it is not there and we lose them, it hurt me so badly. Especially in '79, I had a young man who was only 38-year-old with two children. You know, when he was to go for surgery 2 years because there was no cardiac surgery in India, and so we couldn't go because you couldn't raise $50,000 to go to Houston for surgery, and that what made me saying, why shouldn't we have it here and give it to our people? What was needed is the human skills. These human skills purely I have seen Indian engineers, Indian doctors, Indian technologists were equal in US. The 10 years that they spent, I don't think in Indian space, in an Indian doctor or Indian technologist was anything less. So I said, when we have this, what is needed? Then of course, what is needed in a hospital is a backup service. Unfortunately, the government of US rules then was that for custom duty to import one of the equipment that we have to save the people at home, it was 320%. It's called a luxury. And Baba, the patient is suffering, he needs care, and you call it pleasure, 320% duty. And then they could fund a hotel, they could fund probably a cigarette shop, but the funding was not available for hospitals. But everything was in Delhi. I went many times to convince each of these people, but finally I am happy. Whatever efforts that I took, when Jnana Deo Singh inaugurated our hospital in 1983, September 18, that became a remarkable day for healthcare in the country, because it's not just for Apollo. Apollo, yes, we have continued and done excellence in every single field of care. It started with cardiac, but we didn't stop there. On day one, we made a multi-specialty hospital. Today, the care that's given in Apollo Hospital and every single field of medicine is on par with the best centers anywhere in the world. I must speak to her, I'm a cardiologist, and it started with cardiac surgery. In cardiac surgery, we have done 231,000 cardiac surgery, and that's the highest number in the world. And in healthcare, it's not the numbers, it is the quality of work. This is what Apollo is proud of. This is what I am proud of Apollo family, who has delivered this excellence in outcomes. Our outcome in heart surgery is over 99%. This is nowhere in the world they have got this. So in everything that we have done, it is because that spirit in each of them, they brought out the inner strength, and that's what made Apollo, and now there are another 300 good hospitals in the country. This is why I told our Prime Minister, India can today become global healthcare destination. And send few suggestions what can be done to make it happen. So he immediately called us, Ritu, Sunita, Sangeeta, and my wife said, why shouldn't I also not come? So she also came to the Prime Minister, but he was in business. First 20 minutes, he said, I like this concept, this is very good, we must do it, and we will do it now. And the only thing is, I want to suggest a name from, I said global healthcare destination. He said, I want to call it as Heal in India, because way back in 750 BC, Susa made the first diagnostic center. I agree. I also gave him another paper that there's a huge need of doctors, nurses, healthcare people around the world, in the world. Even India, they won't be short of it. So I understood from his secretary that we have to be left for 1.5 hours. He spent another 2.5 hours to direct the various ministries, and work started. And the very first year, he added 49 nursing colleges, 49 medical colleges, 110 nursing schools, and various other technological courses. Today, last year's budget, she announced saying there is going to be provision for another 70,000 professionals to be trained. I'm sure this budget she will further increase. Sunita has already met her. I'm sure she will impress the. And what I would like to say on this is because we need it and we can do it and we have done it. So this is the three, and then now our aim is Heal India, Healed by India. My third youngest daughter, Sangeeta, is not here. She started another thing called Heal the World from India. That means we can do the patient's reports come back and then handle them. So I think this is the pride. As an Indian, I am proud now today, saying that there is nothing, no field, whether it's a heart transplant or lung transplant or liver transplant or major neurosurgery, all are done in India. A proton, when we brought proton to Chennai, there was no proton in the UK, no proton in Southeast Asia, and Singapore and Australia. So I think what I am trying to tell this is to say that we have come to a very good stage. This is the time we should jump and say, we can help and make India a healthy nation and give it to the world. Because the same as I said, that the deficiency of healthcare people is about 8 million this decade and 30 million by the time 2040. So I think only India has got the young people to deliver this. So we have that. Similarly in home care, when we thought of it, there was a huge necessity. Because patients, one of the patients told me that if I go home, who will look after me? You know? So I think that's a very nice question. It really touched on me. Then the concept came home care. Thanks to the team now, thank Jawahar and his team now. We're celebrating a decade of service. You've done a brilliant work.